Welcome. Thank you for logging in to another video on this series. My name is Lauren. I am a psychologist in the Heart Institute and the director of the Cardiac Neurodevelopmental Care Program. I'm going to talk a little bit about some of the coping skills that might be useful for you while you are navigating your child's hospitalization here at Children's. So I hope to introduce three coping skills. You may be familiar with one or all of these, whether it was in a therapeutic experience previously or just the use of deep breathing that many of us do on a day-to-day basis when we're feeling stress or anxiety. I hope we can talk a little bit more about some techniques or ways to incorporate these skills into your daily life while you're here at Children's with us. And I've also included a few links for videos for guided imagery, as well as some printed instructions if that's a better source of support for you, as well as some apps that a lot of families have found useful as they're navigating the use of these skills. Coping skills are simply strategies that help you deal with stress. They really can be used anywhere. Obviously, they're free to use. And I think an aspect of this that can be really helpful is that they really are great for all ages. So you're instilling these skills now for yourself as you're navigating parenting here at Children's, but these skills may be really applicable or helpful to your child in the future as they're navigating medical care. Along the course of their heart journey. So there are certainly lots of options. We can find what works the best for you. Just as Danny and Laura mentioned in their video about self-care, um, it's certainly individualized, and we want to work with you to find what is best and what is the best fit for you. So the first I'll discuss is diaphragmatic breathing, deep breathing, belly breathing. It's kind of called any of these, but ultimately it's breathing that engages the stomach, the abdominal muscles, and ultimately the diaphragm. And it helps us to fill our lungs most effectively. And there's lots of physiological benefits to this. It can lower our heart rate, our blood pressure, can decrease tension in our muscles, and ultimately help with stress. It increases concentration, motivation, and blood oxygenation. It can strengthen the immune system, and it calms our mind and our body. So, with belly breathing or diaphragmatic breathing, the first thing you want to do is find a comfortable position. I know that's not always easy when you're sitting bedside at the hospital, but what's nice about this is it can be done when you're at bedside, when you're in your car, when you are standing in the room next to your child's bedside. There really isn't um, any particular location that this has to happen. But when you're practicing and starting to work on this skill, it can be helpful to be laying back so that you can use your hands to feel your chest and your belly as you're engaging in this activity. So you'll find this comfortable position. You can begin by placing one hand on your chest and another on your stomach. You can inhale slowly through your nose. As you do this, your stomach will rise, but your chest will remain still, which is a hard thing to do. It's not how we kind of navigate breathing on a day-to-day basis. After you take this slow inhalation breath, you'll hold the air within your lungs for a few seconds, whatever is comfortable, and then exhale slowly through your mouth. Oftentimes, we recommend that inhaling to be around 4 seconds, holding the air in your lungs for another 4 seconds, and then having that exhale be even longer, maybe around 6 seconds. Some people like to count as they're doing this, but it really is about the time that feels right to you. You can repeat this for several breaths. Practicing for just 2 minutes can have so many added benefits, but you can work up to 5 to 10 minutes to really see some of these positive physiological effects. Some other skills of note that I won't get as in depth with are progressive muscle relaxation, where you mindfully relax each part of your body. And this can really be active, where you squeeze and then relax different muscle groups. And with this, you can feel the tension build before releasing and then focusing on the sensation of relaxation. Not everybody loves this one, but it is a wonderful way to help with sleep. So I often find that that's the best time to give this one a try and to practice. There's also a passive version if that is preferable for you. We just do a body scan where you really focus your attention on relaxing each part of the body, starting with your toes and then moving up towards your head. Another is that I just wanted to mention because it's oftentimes a preferred option for a lot of people is visualization. So I've included a couple different YouTube videos here that you could search on YouTube to access. There are varying links, which I included because we don't always have time to dig in for too long. But sometimes having the video to guide you as you're engaging in visualization can be really helpful. With visualization, you can close your eyes if comfortable, or well, obviously watching these videos, you won't close your eyes, but you could start with the videos, getting used to that kind of landscape or whatever kind of area feels relaxing to you. What kind of soaking that in, using deep breathing as you go through the video, and then you can recreate this really at any time, accessing it whenever it feels right to you at the bedside, without a video at all. So when can we use these coping skills while here in the hospital? Before medical rounds, oftentimes is a great chance to calm yourself, to ground yourself, to take a few deep breaths or practice one of these skills before you start your discussions with the different medical team members, sometimes ahead of your child's care or even procedures, so that you can be that calming presence while your child is maybe going something through something that could be a little bit more difficult. Sometimes while driving into the hospital, deep breathing can make a big difference. Um, Prior to sleep, like I mentioned, progressive muscle relaxation or a body scan can definitely be helpful in getting ourselves to sleep, which is not always the easiest thing when we're going times through times that are so stressful. Or just paired with any other activity like you're already doing. Sometimes pairing it with something like brushing your teeth is a way to remember to include it in your day. I've included some apps here that might be helpful to walk you through some of these skills. A lot of them have free options to give it a try, and then if it's something that fits for you, it's something you could continue with. But ultimately, you don't need an app. We're certainly here to help you and would be happy to go through any of these skills more in depth or talk about ways that they could be adapted for your needs. Um, we are certainly here to support you and are happy to discuss this more. So thank you for joining me for this video. And any additional questions, I'm happy to meet at the bedside and to talk further. Thank you so much.